Narcolepsy is a central nervous system disorder which causes persistent sleepiness. Those suffering from narcolepsy may experience excessive daytime sleepiness, or EDS for short. EDS interferes with normal activities and can cause issues even if you've gotten ample amounts of sleep the night before. EDS causes mental cloudiness, lack of energy, difficulty concentrating, memory lapses, depressed mood, or can cause extreme levels of exhaustion. Another symptom of narcolepsy is cataplexy, and cataplexy is a sudden episode of bilateral muscle weakness which leads to partial or complete collapse of the body. It often is triggered by strong emotions such as laughter, anger, or excitement, but it can also come on after you've just eaten. Episodes of cataplexy last 1 to 2 minutes and are not associated with any type of lack of consciousness. 60% of people who are narcoleptic develop cataplexy, but it's not a guaranteed part of your narcolepsy. You may also experience hypnagogic hallucinations, and they are basically vivid and often frightening hallucinations that occur just as you are falling asleep, and is most likely a result from a mixture of REM sleep and dreaming wakefulness. During these hypnagogic hallucinations, usually it's mainly your visual cortex that's affected, but your other senses may be involved. And lastly, if you are suffering from narcolepsy, you may experience sleep paralysis. Sleep paralysis is a complete inability to move for a minute or two just after awakening. An episode of sleep paralysis may accompany hypnagogic hallucinations, making the experience even more terrifying. While it is not guaranteed, some other symptoms you may experience is maintenance insomnia and higher than expected incidence of sleep disorders besides your narcolepsy, as well as a slightly higher chance of getting adult onset of diabetes, obesity, and migraine headaches. While there is no data that completely supports this theory, narcolepsy is believed to be caused by the reduced amount of a protein called hypocretin, which is made in your hypothalamus. But what causes the brain to make less of this protein is still not clear. The hypothalamus normally secretes the hypocretin, and the hypocretin neurons are responsible for keeping the brain systems awake and making sure that they do not shut down unexpectedly. Narcoleptics have a decreased number of these neurons within their brain, and this is why they experience sudden attacks of sleep. Studies have been conducted, and it is believed that the loss of these neurons is caused by an autoimmune reaction. It is a condition where the brain cells are attacked by one's body. As a result, the neurons are destroyed. Other factors that contribute to narcolepsy are traumatic injuries, infection, stress, and dietary factors. Now that you've been diagnosed with narcolepsy, you're probably wondering about your treatment options. The treatment for narcolepsy includes stimulants for the treatment of the sleepiness, an REM sleep suppressant for cataplexy, napping and sleep regimens, as well as psychosocial support, meaning that you may need therapy for all of the stress that your disorder may be causing you. Other ways to deal with narcolepsy include eating light and or vegetarian meals during the day, the avoidance of heavy meals right before important activities, scheduling brief naps that are 10 to 15 minutes long, and planning to take naps during the daytime to reduce the number of unplanned sudden sleep attacks. You should also inform your teachers, supervisors, and other superiors about your condition so they do not label you as lazy and punish you for falling asleep during work hours or school hours. As previously mentioned, you may need to take a prescription drug to help cope with your narcolepsy. The stimulant drug modafinil, or Provigil as it's also known as, is usually doctors' first choice for the treatment of narcolepsy. It is because this drug is less likely to be abused than the other stimulants that they prescribe. However, the other medication you may be prescribed include dextroamphetamine and Ritalin. Also, antidepressants have been known to help reduce the episodes of cataplexy, sleep paralysis, and hallucinations. And those antidepressants include selective SSRIs and tricyclic antidepressants such as imipramine and desipramine. Sodium oxybate has also been prescribed for certain patients to use at night. If It should be known that there is no known cure for narcolepsy. The goal of these treatments is simply to control your symptoms. And it should also be noted that narcolepsy is a chronic and lifetime condition. However, narcolepsy can usually be controlled with treatment, and treating the other underlying sleep disorders can help improve the symptoms of your narcolepsy. Some complications you may experience include injuries and accidents, if the attacks happen during activities such as driving or operating machinery, impairment of function at work, or impairment of function during social activities, and you may experience side effects of your medications. You should call your healthcare provider if you have symptoms of narcolepsy and you want to get tested to know for sure, as well as if you are diagnosed with narcolepsy but you're not responding to any of the treatments or you develop new symptoms.
I'm on a train, but there's no one at the